Welcome back. It's Wellness Wednesday. I am Dr. Long from Long Health and Wellness, and it is Heart Disease Awareness Month. Did you know that heart disease is the #1 killer in the United States? And on top of that, Black Americans are disproportionately affected. In fact, Black adults are 30% more likely to die from heart disease than white adults. There are steps you can take to lower your risk, so let's get into it. Why are Black adults more likely to die from heart disease? Here are a few reasons. 1. Higher rates of high blood pressure. Nearly 60% of Black adults will suffer from high blood pressure by the time they're in their 50s. Number 2, barriers to access for care. So that would be either lack of health insurance, no access to healthcare facilities, being that they are less often in Black neighborhoods, also mistrust of the healthcare system, and other barriers that can interfere with Black Americans, Black adults, from going to the doctor as frequently as their Caucasian counterparts. Number 3, higher stress levels and systemic factors. Chronic stress due to social and economic factors can increase the risk for heart disease over time. However, even with all these things working against us, there are things you can do to lower your heart disease risk. So let's talk solutions. Number 1, start moving. 30 minutes a day of moderate intensity exercise can help to lower your heart disease risk. So that could be walking, that could be playing with your children, it could be dancing. Any type of movement that gets your heart rate up helps to lower your risk. Start small and get going. Number 2, eat healthier foods. So you don't have to give up all your favorite foods or dramatically change your diet, but you can start with some simple changes. 1, increase your intake of leafy green vegetables. Spinach, kale, collard greens, turnip greens, cabbage, Brussels sprouts, broccoli, all of those can help give you vitamins and minerals that help fight heart disease. Number 2, increase your intake of healthy fats. So healthy fats would be things like nuts, avocado, olive oil. So swap out some of your other fats for these options. Number 3, stick with lean protein. So if you eat meat, that would be more of the salmon and chicken and other fish that are high in omega-3s, such as mackerel, herring, sardines, etc. And cutting back on the red meat. If you do not eat meat, increasing your intake of plant-based proteins such as beans, nuts, seeds, soy can be good sources of protein that are also low in saturated fat. Number 3, know your numbers. So this is a crucial part of prevention, is to be aware of what's already going on with you. So things like your blood pressure, your blood sugar, your body mass index, also known as your weight to height ratio, your waist circumference, and your cholesterol. These are all important at letting you know your risk, and you should know these numbers early so that if you are at risk, you can actually modify them and start implementing lifestyle changes to bring your numbers down to the ranges that they are supposed to be in. If you don't know these numbers, it's time to schedule an appointment with your doctor and get checked out. I recommend going at least once a year to get your numbers checked and just the overall wellness check as part of your heart disease prevention plan. So remember, heart disease is serious, but you have the power to lower your risk, and start with the following. Move your body, eat heart healthy foods, and know your numbers. And also, you want to spread the word, because this isn't just affecting you, it's affecting your family and others in your community. So share this video, encourage your people to check on their health. Don't forget to like, comment, share, and subscribe. And I'll see you next week on Wellness Wednesday.